There are different types of ovarian cysts. So which ones do you need to worry about? Ovarian cysts are one of the most common findings in women's health. A cyst is a fluid-filled sac, and in the case of ovarian cysts, it forms within or on the surface of the ovary. So, how does an ovarian cyst form? During a normal menstrual cycle, your ovaries make small fluid-filled follicles. Each one has an immature egg. The hormone follicle stimulating hormone, or FSH, helps one follicle to grow and release an egg. This is called ovulation. After the egg is released, the follicle transforms into something called the corpus luteum. This is supposed to make progesterone in case that released egg meets a sperm for pregnancy. If no pregnancy happens, then the corpus luteum breaks down. The progesterone drops and your period starts. A follicular cyst rupture happens when a follicle fails to release an egg, but keeps filling with fluid and eventually bursts, releasing fluid into the pelvis. It can cause sudden, sharp pain on one side around the middle of your menstrual cycle. A corpus luteum cyst rupture can happen after ovulation. This is when the follicle that released the egg fills with blood instead of shrinking down. If it ruptures, it can lead to more bleeding and pain than a follicular cyst. It typically happens in the second half of the menstrual cycle. So the follicular cysts and the corpus luteum cysts are normal and functional cysts. They are small, short-lived, and important for hormone production. Sometimes these cysts can cause temporary pelvic pain or discomfort, particularly during ovulation, or if one ruptures. A ruptured or bleeding cyst, called a hemorrhagic cyst, can be painful but usually heals on its own. To prevent recurrent painful cysts, doctors may prescribe birth control pills, which suppress ovulation and keep the ovaries quiet. Not all cysts are functional. Some are linked to medical conditions. In polycystic ovary syndrome, the ovaries have many tiny, immature follicles seen on ultrasound. These aren't dangerous, but PCOS can disrupt ovulation and fertility. Another type, endometriomas, occurs in women with endometriosis. In this condition, uterine lining cells grow outside the uterus, sometimes invading the ovary and forming thick, dark cysts called chocolate cysts. Endometriomas are associated with pelvic pain, scarring, and lower egg reserve. Because surgery can further reduce egg count, fertility specialists often recommend personalized plans rather than immediate surgical removal. Dermoid cysts, also called teratomas, are benign tumors that develop from germ cells and can contain fat, hair, or even teeth. They are almost always non-cancerous, but large dermoids can make the ovary heavy and increase the risk of ovarian torsion. In very rare cases, cysts can be cancerous. Ovarian cancer is difficult to detect early because symptoms like bloating and fatigue are vague. Luckily, less than 1% of simple cysts are malignant. Remember that persistent pain, bloating, or changes in your menstrual cycle should prompt you to see a doctor.